Welcome to the Health Unlimited podcast, the only podcast that unlocks your unlimited health potential. Here's your host, Dominic Sembello.
Well, welcome back, listeners. Charlie McDermott, co-host, back here once again, producer of the show with Dominic Sembello. Dominic, how you doing?
Charlie, good to hear from you again.
Yeah, great to hear from you. And how's life been treating you? Is the weather warming up at the beach?
The Jersey Shore quite ready to be swimming. Yes, to swim in, right?
All in good time, right? Yeah. So there's been a lot of talk. I mean, really, the past year, even maybe a little longer, there's this thing called inflation. I think that's how you pronounce it. Have you heard rumors of that?
I haven't seen that anywhere.
And the cost of things are going up and all that, and so we're all, I think, just as a society, you want to be cost conscious. You're always kind of looking for the sales and deals and all that. But then there's, when it comes to you and I, when it comes to taking care of us, maybe that's not necessarily the time to focus on cost. And more importantly, to look at, all right, if I don't do something, what's the cost? And part of that is looking into the crystal ball, which is impossible to do. But, Dominic, again, we've talked about this in previous episodes. The amazing stories that you have from your patients, and the ability to help others who are trying to get out of pain, trying to get rid of some conditions that they're at their wits' end in many cases. What do you say? What do you say to someone? And again, keep in mind, you've got listeners all over, certainly the country, in particular, South Jersey there. But for someone who is, going, geez, yeah, but how much? What do you say to that individual to help them get their life back in many ways?
Yeah, I mean, you're right. Inflation's a big deal. People looking for deals, but when it comes to your health, I think it's more than just financial, right? What's the cost of, what is it costing you to live your life, or should I say, what is it costing you to not live your life? Yeah. So examples of playing with grandkids, exercising, golfing, right? Pickleball. Everyone has their own activities that they like to do, but it can be even more than that, Charlie. Some people literally can't bend over to tie their shoes because they're in so much pain, right? I just had a new woman start yesterday in my office. She couldn't even drive here. Her daughter has to drive her here because her pain is so bad that she can't sit for literally more than like a minute. And as soon as she gets in that car, in that driver's seat, she can't do it. Now, that's a big deal. Now you're talking actual just daily activities of life, as we call it. So, going back to the cost is like, there's a financial cost, but more so the cost of what is it costing you in your life? And that's really, really important. It's something we really focus on a lot in the office.
Yeah. Lifestyle is so important. And for that individual that can't drive today, if he or she doesn't do something, what's going to happen tomorrow? And the burden, she must feel so bad having to have her daughter take her from place to place. At some point you just stop asking because you don't want to bother people, which degrades your life even more so. I mean, it really is a sad situation.
Charlie, let me tell you even more. This is the same woman from yesterday.
Yeah.
Unfortunately, her husband had a stroke. Guess who helps? He needs help at home. So now she has terrible back pain, but she still has to perform, if you will, to help her husband. And so now it's not even for herself, it's herself and her husband.
Yeah.
And anyway, she got started and we're going to help her. Yeah. But it's terrible. But the good news is she found us, and I'm very confident we're going to get her life back, which is really what this is all about. getting your life back, Charlie, doing what you want to do. As I said, whether that's for just everyday, again, what they call activities of daily living, normal stuff that people don't think about. Again, tying your shoes, putting shoes on. Most of us don't think about that. But when you can't do it, that's a big deal. Or doing activities, again, recreational, same thing. That's what living's all about. So I think that's really what we're talking about here today.
Dominic, I'm sure you hear this a lot. Oh yeah, I got pain here, there, but it's what happens when you get old. It's just old age. And what do you say to that?
Yeah. Well, age is just a number. And I truly believe that. I also truly believe your body has unlimited potential to get better. And that's, again, kind of the name of the show here. But that's really in real life what I believe. So age isn't a number. It's not just a number. You should be doing the things you want to do for pretty much most of your life. And sure, are you going to have some aches and pains? Yes. Do you have to? Not necessarily. But it's more like when you ignore those things for 10, 15 years and now it becomes real severe, right? Yeah. That's when the problem kicks in. And even so, I just had another guy who started and he said to me, it was really interesting because it's like he was reading my mind. He goes, I'm 70. He's 74. He goes, I'm 74. He goes, I walk the boardwalk here. And he goes, I'm one of those guys. He goes, I don't buy into this getting old thing. And I laughed at it. I said, you reading my mind? Because I totally agreed with him. I said, you're right. There's no reason why you shouldn't be walking on the boardwalk till you're well above where you're at now. And I said, and we're going to help you do that. So, and he's got degenerative changes and other things that have happened. But regardless, I'm like, you still should be able to do that. And I said, you came to the right place.
Yeah. Yeah. When you think about pain and our willingness as a society to put up with things, back to, well, it's just part of getting old and you think you should be. I mean, I remember as a kid, my grandmother would talk about arthritis and my uncle, with the trick knee or the bad knee and the pain that these folks would put up with, not being able to walk. I mean, just simple things. And what you think about the ripple effect, right? Not being able to walk or be active. So not only are you not getting outside in the sun and feeling better about life because of what's that vitamin D that you absorb, right? You're not. It's like COVID, right? We were trapped. We weren't talking with folks because we couldn't, right? And so you've got that. You feel like you're alone and secluded. The pain just robs us of our energy. It affects our mood. Not being involved with people is going to impact our brain and Alzheimer's and dementia. And then the fact that we're not active, what does that do to us just physically, right? Onset of diabetes and weight gain and all that. So, back to the cost of inaction is significant. I mean, my Lord, if I don't have to take, and I'm very familiar with insulin and diabetes. Our daughter's a type 1 diabetic, which has nothing to do with lifestyle. It's just her pancreas, as doesn't work, doesn't put out insulin. Well, you got to have insulin to live, so she has to inject. But type 2 diabetes is pure, plain and simple lifestyle related. And the cost of insulin is insane. What my daughter has to, even with health insurance. Yeah. So back to, boy, if we can avoid all the medications, not just certain medications, are we better off from a financial standpoint and certainly from side effects, right? I mean, even the insulin that she injects has a side effect that, we don't as really individuals. So it's, there's a cost.
There's a cost.
Yeah.
There is a cost. And yep. Some things like your daughter's situation, right? She was born that way, and that does happen. But almost over 50% of chronic illness can be prevented.
Yeah.
It's pretty staggering a number, isn't it?
Yeah.
So, and these things happen. And so again, most of the time, many people that I see in my office, much of it can be helped, but much of it could have been prevented. But it is what it is. I treat people where they're at, where they come in. So it's more a matter of, are they willing to move forward to get back to doing the things that they want to do?
Yeah.
And in my profession, insurance coverage isn't really great for the majority of it. We don't, it's just not something that's standard, like getting surgery or emergency room. So most people, they invest in their health. They invest in getting better. And again, it's not just financial, because if you were to ask people, what's more important, the vast majority of my patients, when we're getting them the results that they want, what do they say? They're like, this was worth everything to me, because I'm now able to do what I want to do again. Go walk on the boardwalk or tie my shoes. I know, simple as that. One woman, she's just standing for long periods of time, she can't do. So now we're helping her. She's actually able to do things. Now she's actually gardening again.
Yeah. I'm sure, and we got into this in the previous episode, what stops a lot of folks is they've tried so many different ways and so many different times, and they truly have invested dollars in their health. They just haven't gotten anywhere. And, you have become in a lot of ways that final stop, before they get back to health. So 2 questions there. What can you say to folks who are at the beginning of that journey, rather than, stopping at all these other places along the way that may help them save a lot of money and time and get their life back a lot quicker? And then for those who have been down that path, and they're probably, going, I'm certainly willing to invest in my health, but geez, am I going to go through that same cycle again, get my hopes up, and then end up back to where I am currently?
Yeah. I mean, the first thing I always say to everyone, there is hope. And I think I've mentioned this before. I don't know if I did on any of our previous episodes. We're usually the last resort that gets the best results. Now, I understand. I've been doing this for 2+ decades. I understand that people are skeptical, especially when they've done 8 other things before. Most of those are the standard medical care that you normally would do. But when those don't work, people seek out other options. And that is, again, when they typically find me and my office. And I get that they're skeptical. I understand that. It makes perfect sense. And I don't even deny it. But I do say this. What is the risk of doing nothing? What was Wayne Gretzky's? I don't want to butcher it. Wayne Gretzky had a famous quote, was, got the goals. What do you know what that is?
Well, I
something like
basketball.
Do a basketball one. There's that
isn't it? You miss every shot you don't take.
Something like that.
Yeah.
Right. So I always tell people, I'm like, here's what I do know. Right. I do know that clinically speaking, we get 80 to 90% improvement for people. Right. That's pretty, I think, significant. Right. If I was a gambling person, an 80 to 90% improve, the chance that we can help them is pretty high. Now, I have to evaluate people first. So that is a very general statement. But when I evaluate people, if I feel I can help them, it's usually because I've treated it so much where I'm very confident we can. Yeah. So the second part is going back to the risk, right? It's like, I know for a fact that if they don't do anything, they have a 0% chance of getting better. Yeah. So someone can be skeptical, and I think has every right to be skeptical. But the real question is, what is it worth to them? And is it worth trying? Because if they don't try, they have 0% chance of getting better.
Yeah.
Does that make sense? And then it kind of still relates a little bit to the cost. Like, again, not the financial cost. The cost for them is like, is that worth it to them to try to get their life back?
Yeah. Yeah. So you've talked about these different individuals, and depending on where you are in the spectrum, hey, I've been putting up with this for months versus years. What do you see, Dominic? If you could, put someone in the box of a typical and average patient from the time they start working with you, and you do your initial consult and evaluation, and you go, yeah, absolutely, this is an individual I can help. What then? Did they start feeling a difference after the first treatment, or after so many weeks or months? And then what happens once I'm at a point where I'm going, wow, I've got my life back, my energy, I'm sleeping better, all those things? Is it just, okay, I go back to life and say bye or am I plugged in so that I don't regress?
You covered a lot of different topics.
Yeah.
So I'll try to go back to the beginning here.
We're recording this. We may have to play it back. And well, let's start with the first one.
We're going to start with the evaluation. I mean,
yeah.
So everyone is different in regards to what that looks like, right? 5 people with peripheral neuropathy can have similar symptoms. However, in these particular case, I'll just stick with one instance. In the peripheral neuropathy case, we do the sensory tests. So 5 people that come in with a diagnosis of peripheral neuropathy can have similar symptoms, but they can be all over in the spectrum of how severe those symptoms are. And we do a sensory test on their feet to determine how severe of their loss has it been achieved. Then from that point, if we feel we can help them, we then lay out a specific protocols for them, for each individual, based on their score, their symptoms, how long they've had them, underlying conditions. So again, some people might have diabetes in regards to the neuropathy or their cause. Some people don't know why they have it. Some people have what's called chemotherapy-induced peripheral neuropathy. These are individuals that is a side effect of receiving chemotherapy. Unfortunately, they have cancer. So there's different reasons. So one, it's very individual of what that looks like. And that will be discussed, again, on an individual basis.
Okay.
So it's hard to really, put any type of numbers on it because it does vary from person to person. Mm-hmm. If you want to make a general statement, you could say that typically the longer someone has a medical condition, it will take more time. But what happens in the beginning is you have the treatments build on themselves. Okay. So in the beginning, you could get some temporary relief, but I call that, again, that's temporary. What we're looking for when I discuss with people, we talk about what's the solution, where do they want to be, and we will tell them how long, based on all these other things we just talked about, how long I think it will take to get there. So your body, it takes time. Physiologically, it's impossible to improve overnight. And that holds true for physical therapy, right? Working out, which again, you're very familiar with your background and history. You don't just build a bicep in one day or even 1 week. It usually takes several months to see, real change going on. Yeah. Now, it might not take that long for our treatments, but again, it does vary person to person.
Yeah.
I hope I covered some of what you asked today.
You did. You did a great job. Boy, neuropathy, you touched on that. I mean, that needs to be an episode in and of itself, because I see so many folks where we used to live who, Barbara and I call it the shuffle. You just know they're so afraid to lift their feet up off the ground because they've lost that sensation. And it's heartbreaking. And I know those individuals, you rarely see them out in the neighborhood because they're just not able to get around.
We should do that. We'll put that down on a list to speak just specifically on that one, because that's a big one. And it's one where there's not a lot of options for people. We treat that a lot in our office, and with great results, because we use a combination of modern technological solutions with acupuncture. And we have these very specific protocols to help people with peripheral neuropathy, and it gets great results.
Awesome.
But I mean, a lot of these people, sometimes they can't even drive because they can't even feel they can't even feel their feet.
Wow.
That's terrible. But we're helping them, and that's the good news. That's what's at the end of the day, that's what this is all about, getting them their life back. And it's emotional. It's emotional to treat these people.
Yeah.
And you know, I go home every weekend and just I'm thankful for what I do, and I'm thankful that people, you know, allow me to help them and to see how their lives are impacted. It's really it's a good feeling. That's why I'm in this profession.
Yeah. Good stuff. Good stuff. Well, Dominic, anything else that we should know about investing in ourselves, I call it, or the price of not doing anything?
Well, I mean, to everyone out there, I would say it's something really to think about. Like if you're being prevented from doing something that you either need to do just to live, or it's preventing you from doing things that you just love doing. I hope you don't make finances just the only condition, because the cost is far more than financial, and it's about living your life. And so if someone's holding back or thinking about that, it's like, when is it time to make that decision to get back to doing the things you love with the people you love?
Love it. Listeners who want to get in touch, want to learn more, Dominic, what's the best way for them to do so?
They can go to our website at healthsourceacupuncture.com. Has a lot of great information on there, as well as these podcast episodes. We've been starting to post up those as well. Good stuff.
Well, hey, we'll let you get back to what you're doing there, and we will see you in the next episode real soon.
Okay.
Thanks for listening to the Health Unlimited podcast. To learn more about Dominic or his private practice, go to www.healthsourceacupuncture.com.